Dr. Ajay Sharma is a pediatrician who's worked in London for the past 20 years, working with children who have developmental disabilities. Thank you so much, Dr. Sharma, for taking the time to have this discussion with us. My child has been recently diagnosed for autism. What should I know about it?
First of all, the condition autism, we also call it autism spectrum disorder, so we can use either term for it. There are three main things which are affected in autism. The first of those things is communication. Communication using either words or gestures is affected. The second thing is social interaction of the child. Whether the child takes interest in other children and other people, how does the child show interest, that aspect is affected. And the third thing is that these children often have some repetitive behaviors. Either they have unusual sensory interests, like looking at things, licking at things, touching them or mouthing them, or they have some unusual or odd movements of their hand, finger or body. So when we see those three kind of difficulties coming together, we say that a child has autism or autism spectrum disorder.
How do I watch out for early signs of autism in my child, and how early should I look out for them?
Even in their early childhood, children take interest in other people. Children who have autism, they don't show much interest in other people. They don't look at other people that much. They don't direct vocalizations with others, and they don't share their interests with other people. Typical children by the age of about 9-10 months, they point to other things. They try to draw others' attention to their interest. Children who have autism, they don't tend to do that. These children tend to be more on their own. They play in a different way than other children. They lack pretend play or imaginative play in the way they play. They also find it difficult to share with other people. And these signs, and some children can show some sensory behaviors like looking at light or looking at things very closely or looking at their fingers or licking at things and moving their hands or body in an unusual manner. So sometimes you see these signs almost by the end of the first year or 18 months. While in other children, you see these by the age of about 4 to 5 years. So I would say that at any point in time during the early childhood, whether it's 18 months or whether it's about 3 to 4 years, if you have any of those concerns, you should raise these concerns and seek some advice from a professional.
How will my child be assessed for autism?
For the assessment of autism, first thing that's done is asking about your concerns. And then about the child's development for the communication, how the child communicates using words or gestures, how the child shows interest in other people in their social interaction, children's behavior, and about any other concern that you may have about your child. And then the clinician would observe your child, and they would use some tools and methods to look for your child's play, their social interaction, their language, and their use of language. The clinician often looks for any difficulties with child's hearing or vision, and they would also examine the child. They put all this information together as part of the assessment before they would say whether or not the child has autism.
What are the therapies that are useful in autism?
For children with autism, we try to focus on their language and communication. So we take help of speech and language therapists. And speech and language therapists use methods such as signs, symbols, and PACs to help their communication. We focus on their social interaction. We use methods such as circle of friends or social stories. We also focus on their behavior, and we use behavior management strategies with advice from clinical psychologists to help these children. We also think about how these children learn better, and we use visual methods or classroom structure to help them learn.
In some cases, is it really autism, or could it be conditions with symptoms of autism?
That's really an important question, because children who have severe language impairment or those who have intellectual disability or learning disability, they can look like children with autism. Children who have severe visual impairment or severe hearing impairment, they also show features which are similar to what we see in autism. There are some conditions like Rett syndrome or Fragile X syndrome or children who have severe epilepsy. They can also have features which are similar to autism. So it's really important that clinicians who are seeing these children are aware of these conditions and don't misdiagnose children with autism.
How do children with autism progress as they get older?
Well, all children develop, all children learn, and they all progress. And children with autism also learn and progress. Children with autism learn about talking, communicating, and interacting, and they progress. How far an individual child progresses, that differs. So I would say parents should keep their hope, work with their children, give them help early. There are some children, particularly those who don't get early help, and their behavior can worsen with time.
Does the child develop autism at birth, either from the father or the mother?
I think it's a wrong thing to say that the autism has come from the mother or it has come from the father, because families could misuse this situation and blame the mother or the father for the child having the autism. It's not that straightforward. It is quite complex. While autism is a genetic condition, it is also affected by environment, and we don't fully understand how this happens. So we are really not in a position to say at this time where it's coming from, whether it's coming from the mother or the father. Generally, it's the combination. There are a number of genes involved, and it's not at this stage at all clear.
So how do parents handle aggression and behavioural issues in their child?
Children's behavior difficulties like aggression, they happen because either they cannot communicate what they want to say, their needs or emotions they cannot express, and that causes frustrations in them. Or because they have learned that by behaving in a certain way, they're going to get away with it or they're going to get what they want. So one has to, right from the beginning, focus on improving the child's communication and managing the child's behavior so the child learns to behave in the right way. Once the child starts showing violent behavior, then that is a very difficult situation. And the parents often have to take advice from clinical psychologists, make a plan. And the plan is about how to change the situation. The plan is about how parents change their own behavior and what they actually do when the child behaves in a violent manner. They often cannot do this on their own. They'll have to take advice and they'll have to work with other family, the whole family together to deal with this.